Technology for knowledge and awareness. Please welcome our chairpersons on stage with a round of applause, Mr. Carrie James and Dr. Lokesh. And can we also have a round of applause and welcome our speakers, Dr. Prantar Chakrabarti, Dr. Santosh Jacob, and Dr. Ganesh Kumar Parasuraman.
Not sure if I'm supposed to wait till the music stops. All right, hello. Hello, everyone, and welcome to this session, Leveraging Communication Technologies for Knowledge and Awareness. My name is Carrie James. I'm Chief Executive of the World Hepatitis Alliance, and my co-chair will introduce himself.
Hello, everyone. I'm Dr. Lokesh. I'm the scientist here at ICMR National Institute of Epidemiology, and glad to be here, and my sincere thanks to the organizers for giving me this opportunity. Let's move on to the session.
Great. Okay, I can do the first. We want me to do the first? So we have three fantastic speakers today. So first we have Dr. Chakrabarti, who's going to be talking about harnessing technology to strengthen public health systems. Please.
Thank you. And I also have a question with the permission of the chairs. How many of you were there between 8:30 and 9:30 in the morning? Please raise your hands. You can go for a cup of coffee, right? Because I'll be discussing the same things. And Dr. Ganesh is sitting there. He told you what the problems are. Because I have a flight to catch, he will take it up later, right? So this is how vaccines are transported in India. This is not a river, but yes, akin to a river. And this is how ICMR did during COVID-19, right? So drones were used, and you'd say simple, isn't it? So technology is there. We have replaced this human with the drones, and we are getting the vaccines. Now, public health care, public health delivery has its own nuances. And I'll just give you a helicopter kind of view, because it is a combination of resources, organization, financing, and management. And you know, if you look at doctors, they abhor going into management, right? They say, I'll do my clinics, not there. But all these pillars should culminate in delivery of health services to the people, right? Who are paying the taxes or who are the citizens. Now, strengthening of health system, you know, it opens a lot of avenues, but the most important which have been defined by World Health Organization are, we discussed about it in the morning, access, coverage, quality, and efficiency, right? So if you have access and coverage, but you don't have quality or efficiency, you're again down below. So this I have taken from the Ministry of Health websites. This is roughly our pyramid, and it looks very good. But remember, we have 1.4 billion people, right? So there are in lakhs, means for people who are not from India, 100,000. Now you have to remember that if you look at the numbers, right? And I'll show you. So this is our primary health. We keep on changing the names. You know, they also look better, but also certain facets are added. So as of 16th, we had 175,751 functional Ayushman Arogya Mandirs, which include sub-centers, primary health centers, urban primary health centers, Ayush clinics, means non-Western medicine, and other clinics. Now, if you look at this number, and if you say divide 1.4 billion, it appears that there is one center for every 8,000 people, right? So then why do you need to strengthen? But do numbers tell you the story? You imagine the breadth of India and then you imagine the density, right? So we are churning out 125,000 medical graduates every year. The state where you are, it actually has a better doctor to population ratio than what World Health Organization says. But does that tell you the complete story? There is a need for innovation because you have inequitable access, shortage of medical professionals at the place where they're needed, and you need to address, we are at the junction. So you still have those communicable diseases and you have whatever you're discussing today in terms of non-communicable also. You have to improve the efficiency, the reach, and the quality of care. And health cannot be outsourced, right? We talk a lot about the private sector, but there are certain things which cannot be outsourced. Now, let me tell you about the digital health cycle. It was described by Dr. Ganesh in the morning, but the most important thing here is you have to identify the problem and then take a solution, evaluate it, implement it. And we call it fancy names like implementation research, but most of the ideas suffer from a 20-40 syndrome. Means the decisions are taken at 20 degrees, but they have to be implemented at 40 degrees Celsius, and there it fails, right? So we are trying to go from disease to health because we just heard that should you treat all, should you treat select, by treating are we not doing harm? Our goal is not just to partition a high risk status for a specific disease, but you say you have a risk, like 10 times risk of developing liver cancer. Do you know when it will come? Do you know when you should be vigilant? And that likely timing actually can save you a lot of resources. So technology is there. There's another talk on AI. So I'm not entering AI. I'm only talking about NI, that is natural intelligence. If the data comes in, you can do medical forecasting, right? So you have to leverage data analytics, real-time data collection. And as we say in information communication technology, if you do not have data, garbage in, garbage out, gold in, gold out. Early detection and you respond. Sometimes everything is there, but no one discusses the elephant in the room, right? And then, like he said, like for certain things, you have a very limited budget. Your data and not the whims of a particular politician or bureaucrat should determine how the resources are there. Now, what kind of data do you require, right? This is where obviously the newer technologies come in. We still see in so many corporate hospitals that the doctor writes a prescription, it is scanned and kept, right? So this is useless as a data because sometimes it is not even human readable. Another person cannot read the handwriting and it is not machine readable, not machine understandable. So the first thing is whenever you're generating data, the best is obviously if it's the form of a chat, I speak with another person, that gets transcribed, voice to text, and then using either short language models or large language models. In fact, we have implemented it, and the demo is available. It develops into a medical record, but remember that the large language models can also hallucinate and has catastrophic forgetting too. But this is a third generation healthcare system. Scanned prescriptions, some chits here and there, some laboratory reports being carried in the pocket of the patient, they do not mean meaningful data. It has to be machine readable and machine understandable. And electronic health records are only part of the story. You need data from the genome of the person, from proteome of the person, metabolome of the person. But now what we understand, and this was aptly represented by Professor Sareen, is the exposome, right? So metabolome has gone, now it's exposome, which measures all the exposures. And remember, it's not the external, it is also my internal, whatever inflammation I'm having. And you talk of any disease, oral disease, cancer, lung disease, CNS, skin, it means physical, biological, chemical, environment, and my humanistic exposure, which includes my socioeconomic milieu, my lifestyle, and my mental status, my psychological state. Obviously, a human brain would not be able to process all this. So technology already has certain solutions. You can look at the big data. You go to any big data conference nowadays, 30 to 40% of the papers are on healthcare. But if you look at yourself as an Indian, what benefit are you getting in terms of prevention or even cure, right? So exposome means a lot of data. Telemedicine and remote patient monitoring, it does not mean a mere video call. A lot of meaningful data has to go there, and then at the point of care, certain parameters should go there, and then you should know what is happening. If you have seen 1,000 patients at a telemedicine center, you should learn your lessons from that. And like hepatitis B or C, it's a chronic disease management. So this is what is required. Blockchain has been there for almost more than 15 years now, and we say it is secure, there is efficient data sharing, you don't need server to server, it can talk, and people are becoming rich by using cryptos and all that. It can enhance privacy also. So there are a number of publications on how blockchain can be used for medical records. The most important thing is, if a person is able to say good morning and good evening every day, then that person should communicate their problems either to the healthcare provider or to a system by using chatbots. It can be simple SMS, it can be personalized support, and it can be early intervention, where the patterns tell, no, this person can be managed at the point of care, this person needs to travel, or maybe some specialist needs to travel to give it. In the morning, you heard from AIIMS Rishikesh how they are using drones for medical delivery. Some of the Indian pharma companies are also experimenting with drug delivery, vaccine delivery, I have already shown. So there are so many apps. Now, if you want improvement in your lifestyle, you have to develop apps which give the data very clearly. You cannot make a person stop smoking saying that if you stop smoking, there is less chance of developing lung cancer. You have to tell them that if you stop smoking, what will happen in the next 7 days, what will happen in 1 month. So it's about the nudge, the positive reinforcement. And the citizens should have accessible information, personalized guidance. Every person is different, and depending on their behavior, and then you can have mass engaging campaigns. You saw how Amitabh Bachchan played a role. So obviously those celebrities do matter, but most of the people nowadays also have wearable devices, right? And most of the public health data today is not published by academic institutions. Apple as an organization is publishing all of it because unknowingly or knowingly you have given your consent. They are looking at it, they are looking at falls, they are looking at steps, blood pressure and all those things. Important thing is personalized insights and proactive care. You can go on recording that this person is lazy. You give a nudge, come on, start working. What if the person doesn't work? You have to do something else, right? And here, health may not be outsourced, but the role of public-private partnerships in driving the technology adoption should be there. And profits cannot lead to this only. You have to mobilize the resources, but they have to be sustainable, right? So you spend a lot of money, you use drones, and then you see that the cost is 10 times. That does not sustain. And obviously, you have to overcome infrastructure and connectivity challenges, especially in rural area, in terms of investing in building robust digital infrastructure. If they do not have a robust internet connectivity, then whatever you do on the cloud, it will not work, right? Connectivity and accessibility. So it's not a question whether everyone should have a smartphone, not required. But the panchayats can at least have a tablet, and suppose you're looking at maternal child health, how many pregnancies usually occur in a period. You can have that many devices, right? Most important thing here is, and Nexus has brought it out, Horary has written it well, that you have to ensure data privacy and security. Though in a study it has been shown that Indians are 10 to 15 times more open to get their health data shared with others, but you need data protection. We also have our own Data Protection Act. There are certain ethical considerations that in the name of surveillance, you cannot do certain things, and you have to be clear about that. And whatever you do, you have to have the user's consent. If they don't understand, you give them the information. And if you have to support all this, machines will be there, right? But what about the human resources? You have to build a skilled workforce, and that doesn't mean you need engineers, right? You need people who are willing to do it, like they volunteered for people during COVID vaccination using COVID app. And in India, if we have to copy all the so-called disease care systems in the world, it will not be sustainable. So we have to integrate whatever we have. We look at it at the way we understand it, see if it works or doesn't work before crying foul, calling it pseudoscience, and leverage technology to understand whether it works or not. And whether we accept it or not, here's the data. There is significant regional disparity as far as digital literacy is concerned. So, rural-urban divide, you look at the internet access, you look at the broadband, accessibility, training and support. So, someone in a city school has been exposed to it. What happens to the child going to a village school? And you have to have an inclusive design. It has to be human-centric. Just because you have a technology and you bulldoze it, it never works. So this is the ICMR's iDrone initiative. I've just shown it as a case study, delivering TB sputum samples and DOTS medication. 130 hours flight time, 65 healthcare centers connected, and 22,000 medical essentials have been delivered. These are going on for 3 years, but these are still pilot studies. The lessons learned and best practices are humans should be at the center, right? If an engineer thinks that, okay, I have developed this software for the banking industry, I'll make certain changes, change the fields, and I'll use it in healthcare. That never works. Data-driven decision making. Now, if the data is corrupt, then your decision will also be corrupt. And it is not a static thing that everything is written in stone. You have to iterate and reiterate, and there has to be continuous improvement. You have to align the technology solutions with the UN Sustainable Development Goals like health for all, equity, inclusivity, sustainable development. Obviously, if you are increasing your carbon credits, you're burning a lot of things and greenhouse gases, then also it's a problem. Now, does the India's public healthcare system support a culture of innovation? During my MBBS days, community medicine department, it was said that those who didn't want to do anything or did not get anything, they went into community medicine. That mindset has to change. We have to realize that public health is most important. It's a ground field for research and development, for knowledge sharing, and to empower our future citizens. And we have to take the government and the bureaucrats together. There should be clear regulations. If you think that something is illegal, then you spell it out. Do not keep gray areas and then suddenly you say no. But if someone is using your apps, is taking whatever you're saying seriously, what is the incentive? Can you give them one extra leave every month or say every quarter if they walk 10,000 steps a day? We have to think about these things. Engaging with local communities to drive user acceptance and trust, right? People might be literate, though most of us today are not, but still they are knowledgeable and they accept it. This has been shown during COVID. So you need community involvement. I've given the picture where you have a digitally literate panchayat in Kerala, right? And there are cultural sensitivities. So you cannot be ethnocentric. You, being brought up in the city, think, oh, this person is not accepting, he or she is an idiot. No. You look at the social values of how they have been brought up. You have to deliver an empathy map, and whatever you do has to be accountable and transparent.
Sorry, can I just ask you to?
Yeah, I'm just wrapping up. This is my last. So we already have the digital mission ecosystem. Does anyone remember these 2 episodes? Anyone? Boeing 737 MAX. State-of-the-art technology. The technology was such that the pilots could see that the planes were crashing, nosediving. They couldn't do anything. It led to loss of lives, right? So, as I always say, just because you have a technology, you do not fall in love with the solution. You fall in love with the problem, then develop the solution, and I think we will be able to strengthen our public healthcare system. Thank you.
Thank you, Dr. Pranthar, for your excellent presentation.
I have to leave because I have a flight. Okay.
Yeah, please be seated, sir. So as Dr. Pranthar has to leave to catch up with his flight, so if there are any questions specific to his talk, I request audience to come forward. Okay. Thank you. If there are no questions.